start with this small bump at the top of the back, known as the vertebral prominence. This landmark is the result of the spinous process of the 7th cervical vertebra, which is especially long, and therefore creates a bony surface bump that can be easily palpated. In this same region, we can spot the surface landmarks created by the underlying trapezius muscle. As we can see here, the trapezius is a very large, diamond-shaped quadrilateral muscle of the shoulder girdle that covers a particularly large portion of the back and also forms part of the shape of the neck. Remaining on the upper portion of the back still, the outline of the scapula is also quite easily distinguishable and can be palpated here. The spine of the scapula, as well as the medial margin, and the inferior angle of the scapula are all quite easily identifiable. The scapula isn't a stationary bone, so keep in mind that its associated surface marks will also change position depending on the movement of the arm. An interesting clinical note is that there is a relative thinning of the musculature of the back situated along the medial borders of the scapulae. This area is known as the triangle of auscultation of the lungs, and during clinical examination, a stethoscope is placed on this region of the back, allowing the clinician to hear the respiratory sounds more clearly. Along the midline of the back, we can also see a longitudinal depression known as the spinal furrow. This landmark is continuous from the cervical region down to the gluteal cleft and overlies the vertebral column. It is formed by the combination of this and the adjacent sacrospinalis muscles. This line is easy to see in most people as it tends to be present regardless of the body fat percentage. Another landmark on the back is one that is not always visible in all individuals. This rhombus-shaped contour is known as the rhombus of Michaelis and is believed to be of some clinical significance with respect to normal childbirth. Two landmarks that may also be visible in this region are the dimples of Venus. These dimples represent the point at which the sacrum attaches to the ilium of the pelvis. They are believed to be genetic and so may not be present on all individuals. Also similarly distinguishable on the surface of the lower back is the form of the sacral triangle. This refers to the surface area over the sacrum, which is a large triangular bone at the base of the spine, highlighted in green just here. Finally, moving further down, we can plainly see the gluteal region, which is characterized by the buttocks. The buttocks are by a group of 3 gluteal muscles, the gluteus maximus, the gluteus medius, and the gluteus minimus. At the inferior aspect of the buttocks, a sulcus or fold is formed known as the gluteal sulcus. Finally, in between the 2 buttocks is a vertical groove known as the intergluteal cleft. This groove which separates the 2 buttocks is also known as the anal cleft.
If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.